Are you a caregiver, caring for an aging parent, relative, or maybe a loved one? If you are, you're certainly not alone. In fact, 4 out of every 10 adults care for parents and relatives, seniors suffering from chronic illnesses, including heart-related diseases, and the many issues of old age itself. Welcome to the second in our 4-part series dedicated to the American caregiver. Back in the studio as we observe American Heart Month is Dr. Jon Segal, CEO of Discount Medical Supplies. Welcome back, Doctor.
Thank you very much for having us back.
And I'm really glad you're back again, because in our first segment we learned so much about the caregiver and the patient and so much information that we need to know about. This month is American Heart Month. Tell me how the caregiver today can help the patients that are suffering from heart diseases, congestive heart failure. We can go on and name the lists.
Well, it's tough for the caregiver themselves, because obviously they have to abide by what the doctor's wishes are, number one. Number two, helping with their diet, their nutrition. Number three, I would say definitely exercise. Helping to get that person out of the house, into the sunlight, I think is extremely important. We forget about that. And number four, laughter. I think the caregiver never laughs, never really takes care of the person, so it's very difficult because they forget about themselves when it's so challenging with a family member.
So what are things that one can do when you're a caregiver, not just financial, but what are the supports can they look for in that time of need?
Well, there's a lot of support groups out there. You can go to your VA hospital, you can go look for an ombudsman in your area. Also, the areas on aging are fantastic centers to get you, or it's basically your main portal to the area and all the support that's out there. But I think what people again forget is they forget about family and friends to help them through the situations, because friends can actually be the biggest support, where they can come take that family member out for lunch, take them outside, and give you a little bit of a reprieve as well.
Now, there's other supports, and there's something that I want you to share with our viewers, and you created an online store aimed at helping caregivers. Tell me exactly what it is and how it helps them, because I think it's so valuable for them to hear.
Yes, we created discountmedicalsupplies.com because of us. We were caregivers, and we wanted to give back to everybody. So when they walk into a store or they go online to buy their medical supplies, we didn't want it to be overburdening to them. We didn't want them to be scared or frightful. So we walk them through the process, whether it's an online chat, whether it's talking to one of our representatives. We guide them into the right products that are best for them, not the more expensive products per se.
So someone is there actually live talking to them and saying, hey, this is what we can walk you through and help you out?
Yes, we're actually there from 9 a.m. to 12 p.m. midnight, Monday through Thursday, and throughout the weekend as well, so we can get there when they need us. And we walk them through what is the right size, how much do you weigh, what are you looking for, what are your daily activities, and then we choose the right size and the right fit for them. And it's very different from just guessing among thousands of different products.
And if they don't have maybe a list of things that they need from A to Z, your people can also help them and say, hey, we also recommend this?
Yes, we'll help them by their condition. So if they have diabetes or heart disease per se, whatever it may be, we'll walk them through and give them the top selling products that are basically needed for them, and what's recommended based on their situation.
Can you name some of those products that usually are really the ones that are the go-to?
Incontinence. Unfortunately, diapers are probably our #1 product, wound care, walkers, rollators, and this month especially, blood pressure monitors and blood pressure cuffs.
So doctor, after someone is, let's say, guided through the website and they get the stuff they need for their patient or their loved one, is that then brought to their home?
It is. We ship directly to their doorstep, so they don't have to be embarrassed about what's coming in the package. And we think that's very important for them and really their self-esteem.
And I can only imagine how much easier it is for the caregiver to not have to worry about going to get something rather than spending time with the loved one there.
We like to partner with them. So we're your partner, we're your friends, and we're going to help you. We're not trying to sell you something. We want to help you through the situation, because a lot of times you don't have a person to talk to, and we'll be there for you to talk with you as well.
It sounds like you are an advocate, which is wonderful.
Yes, I am.
Thank you so much.
Thank
we'll
you
see you
very
next time
much.
again for part 3.
I look forward to it.
No, and I look forward to it too. Thank you,
you.
Doctor. We're going to continue with this subject in a future show. In the meantime, if you'd like to learn more, including more about American Heart Month, visit us at thebalancingact.com or log on to Facebook/The Balancing Act fans. Share with us your own caregiving thoughts and opinions. We'd love to hear from you.